homeless challenge in New York City before COVID, I think everybody appreciates was it's the worst it's ever been.
Yeah.
It's ever been. And there were so many people that were on the edge. I mean, when people, think of homelessness, there's a lot of very stark images of street homelessness, and there's mental illness that's a part of that. And so they're also at significant risk. But people don't appreciate that 1 in every 10 children in New York City public schools was homeless before COVID.
My goodness.
So there are lots of families living in shelters, living double, triple up, living in ways that are not sustainable. And there were so many people on the edge because housing is the biggest cost in this city. It's so expensive to live here.
Yes.
So many people have fallen off the cliff now as a result of COVID because they've lost their jobs.
My goodness. And that means a lot of vulnerable families and vulnerable children. In terms of actual numbers, to give people the scope, how many kids are we talking here? How many vulnerable or potentially displaced kids are we talking here?
Well, there are 1.1 million children in the New York City public school system. So that's over 100,000 that were already in homeless shelters. 700,000 of those children are basically in poverty, just generally. And those are the children that certainly are now not getting those additional meals that they counted on every single day. And I think it's important to appreciate that of the numbers of people in the city that just don't have enough money to make ends meet, before COVID-19, 85% of them had somebody that went to work every single day. So it wasn't that they weren't working, it was that the wages weren't enough to support what their needs were. And almost 70% of the jobs that have been lost are people that make less than $40,000 a year.
70%?
Yeah, 68% of all the jobs that are lost. And also about 70% of the people who have lost their jobs are people of color.
That's a huge hit.
It's a very huge hit.
And I think the other thing to note as well is that the frontline workers are also people of color.
Right.
The number of people that work at the MTA, that drive the buses and keep the trains running, that 41% of them are Black. That's the largest ethnic group when we think about the number of people that do the grocery stores and the essential workers, the healthcare workers.
Yes.
And from my understanding, a majority of them are women of color as well.
Women of color, absolutely. And what we're also seeing is that they're getting sick and dying at incredible rates. And many people, once they've contracted the virus, they're coming home and they don't have the supports they need in their homes to take care of their families.
Right. I mean, some of these are also single parent households.
Absolutely.
Oh my goodness.
Yeah.
So we're raising funds, but also can you tell us a little bit about what the funds will do? So we've heard about these vulnerable populations, and boy, oh boy, that is ripping at my heart so much. When people donate funds, how do you use them to help these vulnerable populations?
How are they appropriated?
Absolutely. So one of the biggest, the first priorities is making sure that emergency needs are met. So investments to the funds, so we've done things like we have provided food for
Oh, Sheena froze. Oh, there.
For weeks. Can you see me?
Yes,
we got you.
You're good.
Okay. and so we've been investing in emergency food delivery to families because you're not supposed to be outside. We don't want people congregating. So we've been working with partners to deliver weeks worth of food to homes that have, particularly with a big focus on homes that have children. We've been working, the money would go to put food on the shelves of food pantries and soup kitchens. That's a big part of what we do. When we're just going in the supermarkets ourselves, we see that shelves are bare. People don't have
She might be getting
the things that they need. And And so our job is to make sure that there's food on the shelves. We're also working to help the food pantries and soup kitchens get gloves and masks as well. We're also helping low-income kids get educational equipment. 68% of low-income kids don't have books at home before COVID. There's a digital divide. So we're building home libraries, sending books to homes, getting them iPads and other devices so that they can, their futures are so fragile right now, not getting the educational opportunities they deserve.
Right. I think that's something that a lot of us forget, that school can mean so much for a child, particularly low-income child. I think, for us, it resonates in part because we too lived in New York City. Winston here actually went to the New York public school system. And I think it wasn't until we started talking to you that he said, I never really put into value what food at school meant to me.
I was getting 2 out of my 3 meals a day from school, and I wasn't really thinking about it. I was going to school early in the morning, getting breakfast, my chocolate milk and my eggs, and I'd have my lunch at school and even a snack. And I never really thought about that until our last conversation, just to how much value that was adding into my life and my family's life, to not have to worry about putting those meals on the table for me.
Because being able to have those meals meant you could cover the bills, pay for rent.
Especially making under $40,000 a year, like you're pointing out.
Absolutely. And we just did a survey, and what we found is that many parents are skipping their own meals so that their children can eat.
Parents are skipping their meals so that their kids can live.
Yes.
Wow.
It's a big choice.
This is the United States of America, right? In 2020, that we shouldn't be here.
Plus, nutrition is so important, even for preparing your immune system to fight off a potential infection with coronavirus. That a parent choosing not to eat so their kid can eat makes sense. We get that, but we also need to help them be able to eat so they can survive, to help their children. So guys, if you're watching, do please consider tapping the donate button and donating to our fundraiser here for the United Way of New York City. We are helping families that are in vulnerable states right now. And we're talking to Sheena Wright out of the United Way in New York City. And this is, wow, what a conversation. Winston, I know you had some questions.
Well, I just wanted to know as well if there are any gender specific needs that people might not be aware of, that might not be coming or be top of mind, front of mind, that we could probably bring awareness to. Are there any things that you guys can think of?
In terms of some of the needs of the people that we're serving?
Yeah.
So certainly, when we think about women's and women's health and the disparities there, I think a lot of the challenges that women of color in particular feel with engaging in the healthcare system and really being, trusting that system and really feeling that their needs are being met. That is a challenge and continues to be a challenge in COVID-19, unfortunately. What we're seeing is, some people are going to try to get care and their symptoms are not necessarily being taken seriously. There have been articles about people that have been just sent away and sent home and that their conditions worsen. And so a part of the work that we're doing as well is that we're investing in social workers that are working with families to really help them advocate for their needs, and also connecting them to the right institutions that are going to meet those needs. That's really important. Another thing that we found, and there's certainly also been stories about from a gender perspective, is that some of our men and boys feel very uncomfortable wearing a face mask.
Yeah.
And we've seen some real disparities in how people have been treated when being engaged or what the police around social distancing with other people. And it's really important to wear a face mask. So how we are making sure that we're communicating in, you know, every way possible, and with trusted messengers.
Right.
I mean, we have to make sure that, you know, we have the right people talking, and so that people believe and understand and will adapt is important. And then just even, you know, I mean, we talked a little bit about this before, but the cultural misinformation that was going on,
100%.
It was so crazy.
Yeah.
Like, oh, Black people can't get COVID. Now we should know better than that, right?
We should.
I think that's one of the biggest hurdles around this entire pandemic has been misinformation and a lack of being able to trust who the messenger is, like you're saying. And that's a huge thing when it comes to prevention, when it comes to what we can expect. If you can't trust the message, what are you supposed to do?
Yeah. And I think that's so important, and you're right, because there was a lot of misinformation, dare I say disinformation, put out in the beginning that led to very vulnerable communities misinterpreting the message. And that certainly wouldn't have helped here. I think for a lot of people also, when we see the stories in the media, we're seeing sound bites, we're seeing clips, and we're missing that big picture, which is if you hear of the mom who's the healthcare worker, what about the kids who are left at home, the family that's left at home, the people she cares for when she goes home? And certainly I'm worried about that. I'm also worried about, in terms of gender specific things, gender-based violence, and those who are now having to go to shelters out of need for safety. And I worry especially about the children, those kids whose parents are maybe hospitalized or, God forbid, succumbed to COVID-19, or those succumbing to other diseases, because I'm sure in New York City there are lots of other health problems that are still prevalent and need to be addressed here.
Yeah, they're all converging at this time.
Yeah, asthma, diabetes, and all of these things put people at greater risk. I mean, and that's why the trusted messenger, I mean, people like you all who go out and beat the drum and give, you know, the facts and the information, that's what we need so much of. And you were talking about a mom, you know, coming home. We had one family, a single mom. She had 2 kids in a school that we work very closely with, one in 1st grade and one in 3rd grade. And she got sick and she had to be hospitalized. She left the kids with someone, and that person got nervous and actually left the kids in the house. And she got home and didn't have money, is still recovering, is concerned about her kids, and we immediately had to get her some food and emergency funds in connection to a social worker. But like, that's happening by the thousands.
Wow.
And that's what we have to really address.
I think it's very important for us to articulate today that is a big part of the mission of United Way, which is collecting information about vulnerable communities and how these things impact vulnerable communities, getting direct, specific numbers so that we can communicate what the need is. Can you talk a little bit more about that, Sheena?
Sure. I mean, our work is focused on diagnosing and really drilling down and understanding exactly, as you said, what is the need. So we do a study regularly where we measure exactly how much money you need to live in order to in New York City in a particular neighborhood. We measure how many people have asthma or diabetes or any other issue. So we can tell you, if you're a single mom, you live in the South Bronx, you've got 2 kids, that you need to make about $50,000 to make ends meet, to pay your rent, food, and no frills, nothing fancy. And we can also tell you that 80% of family households in that neighborhood don't make that. We can also tell you that that neighborhood has waste treatment centers and all kinds of other environmental challenges that make it the largest concentration of people that have asthma in and we can also tell you that the data on fresh food that's available in the food deserts that are contributing to diabetes and other health challenges. And so then our job is once we do the diagnosis of what the challenges are, but we also look at the assets. There are organizations and churches and other institutions that are doing the work, and individuals, and there's strength in our communities as well. So after we diagnose, we help, we do the diagnosis, then we work with the community to design a plan for their own outcomes that they want to achieve. Wow. And then our job is to also help that community deploy, we call it the 4Ds, deploy resources, money and manpower, because these plans need to be resourced on how we're going to change these outcomes. And we also need volunteers. Our work can't happen without volunteers. The food pantries and soup kitchens in New York City cannot function without an army of volunteers. And then last but not least, we drive for system and policy change. We don't want to just be doing program by program on the ground. We want to take what we've learned and go to government and say, we need to do this at scale. We need to solve the problem and not just put Band-Aids on it and address, some of the symptoms. We want to get to the root cause.
Right. And that's important, because I think for a lot of people, as we start hearing these stories, we're moved to donate, yes, but we're also asking, where are the numbers? How do we know these numbers? So it's important to know that there are organizations like yours that are coordinating, but also working with the community organizations within the smaller communities in the city to actually bring the results to the people. Because I think for a lot of people, the worry is you have these studies, you get the great report, but then nothing actually comes of it for the community. So it's great to hear that. Now, Sheena, for those who are listening, who are saying, I want to get involved, I want to help with this. I know the city's on lockdown, but I have masks. I want to volunteer. We want to help. How can they do that?
I absolutely, I will tell you. And I just want to tell this little story about Ruby D, famous, this wonderful ancestor. I went to hear her speak one day, and she said, I go to all these meetings and these conferences, and people have conversations about the problem and the issues. And she said, I want to know, what is my assignment?
Yes.
And I just thought that was so powerful. She said, we need to walk out of here with assignments. We need to activate. There need to be things that we can do. So in answer to your question, we have things for people to do, because we have been doing this work and diagnosing and designing, and we need volunteers, for even virtual volunteering. We're actually setting up a platform. If you have a set of skills, we work with 600 community-based organizations, and they all need some help right now, just even working virtually in all kinds of things. If you have ideas and thoughts, one of the things that we are just hearing from our families is that, who have young children, they need new clothes. They've grown out of everything, and they don't have, money for food, but certainly not that. So if you go to our website, uwnyc.org, you'll find information about the COVID-19 fund, all kinds of ways you can get involved. We've got like a yoga studio doing online classes and having people donate $10, which is great. We had a company that we weren't familiar with, but they make helmets for motorcycle bikers, and they're doing a portion of their proceeds for helmets. And we just have regular people who are sending in donations, sending loving energy is always appreciated. But there's something that everybody can do, and we encourage you to do it.